Hi, and welcome back to Recovery His Way. I'm Stuart Whiting. I'm here again with our director, Tom Reynolds, on the campus of His Way in Huntsville, Alabama. Hey, Tom.
Hey, Stuart. Good to be with you.
Tom, I want to revisit a topic that we talked about last year as the pandemic was started. We were starting to realize what life was going to be like for a while and how impactful it was going to be into this community of people struggling with substance abuse. And I know you and I talked about it. And we also had a Zoom call with Brandon Lackey down at the Foundry. And let's go back to that time and maybe share what your concerns were as we thought about what life was going to be like.
Right. Well, obviously with the pandemic, there were a lot of things socially going on in terms of isolation, locking down, distancing, in terms of, in order to manage the public health issues. The problem that it created is all those things were exactly antithetical to what addicts need. So when recovery things started shutting down, AA meetings not meeting, recovery programs not intaking people, those kind of things, that was a huge impact on the recovering community. Plus, then the isolation and all that kind of stuff drove up the anxiety levels, which would drive addicts to using more, employment issues. I'm not working. I got a lot of extra time. I don't know what to do with my time or myself. And so I end up going to my recreational responses, which are drug and alcohol use. So, we've saw tremendous spikes in not only the abuse of those things, but also the lack of support for them.
Yeah, and the article that just came out within the past couple of days that maybe some of our viewers have seen, some of the numbers now are coming in trying to, you hate to quantify all this, but that's what you can do on a large scale. And that drug overdoses in the United States leapt nearly 30% in 2020.
Right.
And is that a surprising number to you?
Well, it's a tragic number. But a couple years ago, I remember speaking a lot about, the tremendous uptick in opioid deaths. It was hitting 70,000. And at that time, we were talking about how devastating it was to our community that, that was more people dying in 1 year than had died in the entire Vietnam conflict. Right. I remember we made that analogy. Yep. And you see the protesting that went on about our young people being put in those situations and dying. And where's the protest here? We're having that happen in Vietnam. It's happening every year in our streets and in our homes and that type of thing. And now to have it jump that high, to 70 to 93,000 is incredibly devastating. Yeah.
And, at some point along this, however you track COVID deaths, we're now exceeding that in daily overdoses and deaths due to overdose than to COVID, which thankfully is on the decline. Right. And that's not going to change anytime soon, right?
Well, and some of the things, it's always a struggle. I realize in our society it's a struggle because sometimes the solution's worse than the illness itself, kind of thing, and definitely in the recovery community, AA meetings when they quit for a while, then they went to virtual meetings for a while, but nobody really participated that much in the virtual meetings. Because we've discussed this before, Stuart, the key to recovery is connection. It's intimacy with people. It's reconnecting with people. Drug addiction is about disconnection and recovery is about connection. Well, so everything about COVID was about disconnecting, right? Isolating, staying at home, and then driving up the anxiety with the media and all that regarding the hysteria and these terrible, concerns about the future and how many people are dying and the terrible tragedies going on, which were truly there, and yet all that just drives addiction. It just it was a terrible, tragic, perfect storm, if you will, to driving up these numbers. Yeah, and we saw, even when you look month by month, I was reading where, May of 2020 compared to May of 2019, there's like 60% increase in overdoses just in that month alone. And so it was a direct correlation, obviously, what was going on in our community regarding the COVID isolation.
Yeah, go back to what you said about virtual. I imagine a lot of programs did try to get back virtual after the immediate shutdown, probably within a month or two. So even this number, as high as it is, reflects that most of the year meetings and those kind of things were available. But maybe speak to why a virtual meeting is something very different than in person.
Well, I mean, it's like anything we do as individuals. You think about, if you go back to church experiences, for instance. I mean, what's the most meaningful things about church typically is seeing people when you get there, seeing people when you're leaving, visiting the parking lot, those interactions, that time together, those, not just the service on TV or something like that, that you can kind of capture in a television program or a virtual thing. And same thing with AA meetings or even counseling things. It's the same type of thing. It just proves to me that, and we know this, that, information's only a small piece of what a human being really needs to get fully benefited spiritually from the experience of interaction. Information's, one part of it, but hugs and just intimacy and connectedness and involvement and even just getting in your vehicle and going somewhere else and walking into a different place and all those kind of things are part of the recovery dynamic that's important. And we can't forget that.
Yeah, and we're thinking of ways that we can extend our program, and our vision is to advance Christ-centered recovery. And thankfully, we're getting a chance to do that in real time now in Atlanta. Right. But I can't imagine that we would ever decide, we're going to have like a take-home packet, and you just go through on your own. Here's the information. Here are the video clips. There may be some value, and maybe 1 in 100 or 200 people can really glean from that, but we've got to be together.
Right.
And we get the blessing here of a beautiful campus and a lot of time spent. And it's all the unplanned things that have so much value that you can capture.
When you listen to the guys even talk about the recovery experience here, very little of it is captured in the classes or the lessons that are taught or the books that are read or the, the MRT conversations that they have or the blanks that they fill in on some worksheet. It has to do with my roommate and eating together and times we spent, talking and, the planned things and the unplanned things that just happen relationally that's so critical to the human experience.
Yeah, it seems like I was talking to one of the residents earlier this week, and we're in a time of world history where you can really survive right now, in a sense, without having to be part of a community. You can have food delivered to your door. You can, live off of the internet, and really that wasn't an option going back, in some period of time where you just had to be a part of a community, and how devastating that is to try to live that way.
Well, and one of the things that you see in all this is that as maybe if you want to call it secularism continues to grow, and the view of man that sees us more as kind of this evolutionary biological things and not spiritual things, we're going to miss the target on what people really need, because the reality is we are spiritual people, and we aren't just a product of some evolutionary process. We're designed by God, we're in the image of God, and connectedness and the things, those intimate things and those spiritual things are a key component in everything we need to be about in recovery, and I think in life in general.
And, I like to emphasize to the guys as we're going through Genesis that the first time God said there is something not good, it's not good for man to be alone.
Right.
And I know it's easy in an addiction, maybe in the shame and in the isolation from a family to retreat into yourself, and all you're doing is making it harder, right, to ever seek real recovery. And I know it's a real eye-opening kind of in a warm experience for the guys when they come on campus and realize, all right, people who care about me, people who want what's best for me, and that can really change a heart as much as anything else very quickly.
Well, right, and I think that's a key part of what this is about. It's been a key part of it for 14 years I've been out here, is the relationships you build. And those relationships aren't just experienced within the 6 months or 9 months of a program here. I mean, I have relationships with guys that, I've had for, years and years and years. And, they've been to my home and we've spent time together. We see them in public places or at church or those kind of things, or phone calls and text messages. You
don't schedule all those meetings through?
No, it's a virtual thing. No, and that's an important part of the dynamic. In fact, I know we talked about this yesterday. We had a guy who was a dear friend of mine. He had graduated this program in 2012 and 2013. He'd been an integral part of this ministry for a long time. He'd been at my home for Christmas. His son had been a part of our family at various times. I'd been a part of his wedding. I've been actively involved in his life. And he called me or messaged me on Friday or Saturday begging to come back to the program. And we worked on trying to come up with a way. Obviously, we have a long waiting list, but some of those people weren't able to come, and there were some openings, and so we kind of negotiate things a little bit, navigate things, and so I worked out a way for him to come in actually this morning. He would have come into the program. And so he didn't have any money, of course. He was broke, and he was destitute and in a desperate situation, saying, I'm going to die if we don't do something. And so, we got the money for him to get in. We got it worked out for him to get a bus ticket here, and all that kind of stuff got worked out. And then I didn't hear from him for a couple days. And then on Tuesday morning, he contacted me and was saying, I don't know how I'm going to get here. All of a sudden, I thought I had a bus ticket, so we had that conversation. And then he kind of didn't hear from him after that. And then yesterday morning, I got a phone call at 10 o'clock in the morning from his family saying that he had overdosed and died. And that's devastating. I mean, that's a number, but it's way more than a number. Right. It's a friend of mine. It's a guy that helped start some of the integral programs. I mean, he started our Feed My Sheep program initially, where we feed the homeless here. He's the one that said, hey, let's take a box and give it to a guy under a bridge, and we've been doing that for 8 years, every Saturday. And so it was, it's devastating to, have to go to a family and be with and watch a 10-year-old boy, go absolutely berserk, knowing that he'll never see his daddy again.
And he was a bright guy who had a sense for how to make things happen and make his way in the world.
Right. And I guess it kind of doubled on, not only was that just a personal impact on me, and the program here, because so many of us knew him well. I had in front of me here, I had been working that day on getting ready for our board meeting that's coming up. We do quarterly board meetings. One of the things that I do is give a lot of statistics on what the program, just let our board know what's going on with the program. And one of them is always I try to give a report on, to connect with it, is who are the guys that, have been in the program who have passed away since we last met. And usually there's, 2 or 3, tragically. But, I was working on this list, and I had 6, on this list. And
in the last 3 months.
Yeah, in the last 3 months. And so, and those aren't just, that's all funerals I personally attended, families I had to be with, people who are intimate part of our program here, and they're young. I mean, 39, 30, 33, 50, 33, that kind of 25.
25, yeah, he was really young.
And so I was putting together that list, and I had already printed it and everything. I had it ready to get ready for the meeting, and then I had to pull it back out and add one more to the list yesterday. And it's tragic to see names and lives and young people and talented people in every one of these guys. Tremendous talent, tremendous capabilities. Yeah. And we're losing a generation of young men and women who have so much to offer that could make our society a better place if it weren't for this. So really, it really is tragic, and we need to do something. We need to do more to help that. Obviously, this COVID situation has not helped, and the recovery from that long after COVID goes away, the consequences of what we did during the shutdown will continue to have an effect. And we'll see, and tragically, more of this. Hopefully we can turn the corner. But, one of the things that I try to focus on with our program is, there's government is going to work on policies, try to make things better. Our judicial system is going to work on trying to have alternative sentencing, not punish, not criminalize people maybe as much in the future. We're going to have law enforcement stepping in, trying to interdict and stop the flow of drugs and stuff into this country. But as long as people want it, we can't stop it. And that, the one thing that my vision is, my calling is, I think the calling of His Way, and I think the calling of the Christian Community in Recovery is to bring the message of Christ to people so that they can discover a satisfaction that takes away this craving. I had that conversation this morning in class. We were talking about the Beatitudes, and the fourth Beatitude there is hungering and thirsting for righteousness, that they will be satisfied. That's the only place where satisfaction can actually happen in a spiritual person's life, is having an appetite for the things of righteousness, the things of God, and finding the fulfillment, the satisfaction, the contentment, the wholeness that comes there, that ceases the striving, that ceases the craving. And if that doesn't happen, no amount of political, social, medical kind of solutions are going to work.
Yeah. One of the buzzwords in the opiate crisis is fentanyl. Could you just explain why fentanyl is such a major component of deaths now?
Right. Well, let me back up a second and kind of explain. When I got into this 14 years ago, most of the guys coming through my door were coming in here because they were on pain pills, opiates, primarily related to what the pharmaceutical companies were producing, Oxycontin, hydrocodone, stuff like that. And the government stepped in, and Big Pharma got kind of knocked down. They got a lot of restrictions placed on them. Doctors ended up with a lot of restrictions placed on them. Pharmacies had a lot of rules and regulations they need to follow. And so the distribution of those kind of drugs was shut down dramatically, which pointed to my point, because the demand hadn't changed. It just all of a sudden just elevated and escalated the heroin epidemic, which is really what's driving the opioid issue, is heroin. Fentanyl is a very potent painkiller. It was originally being used, it's used typically as patches to give to cancer patients to help them deal with long-term pain relief. And so it's highly potent pain reliever. And so they can get it easily, and they lace it in the heroin. It's pretty cheap. It's easy to get. You can spread it out. It makes the heroin go further, and the impact of the drug higher. So it increases the value, the experience of it. The problem is with all this, and the reason why we're seeing such a high level of opioid deaths, is because at least when you were taking Oxycontin and that kind of stuff, a pharmacy company had a dosage amount, and you knew the dosage and you knew what was in it and all that kind of stuff. Yeah. And heroin, nobody knows. Every time you stick a needle in your arm, you don't know what you're putting in. You have no idea where it came from. It's not like, there's some prescribed amount that you use. You don't know what's in it. And these guys are... And
who put it together, and what state of mind they were in, or what their knowledge was.
Right, exactly. And so the problem is that these guys are injecting heroin, thinking it's heroin, and there's fentanyl in it, which is much higher dose, and it's killing them. And that's the biggest problem. And the fentanyl is laced in all kinds of things, not just heroin, but that's the main thing going on right now. So that's what's killing our young people right now, is that.
And that can be very much in a single dose kind of setting, right?
Absolutely. That's what happens. And it happens a lot with people who are trying to recover. That's why this list I have is these people are close to us, because they've been in our program or gone through our program, even graduated our program, and they relapse and they go out and do what they did before. But what they did before isn't what they did before. One, their body's they had built a tolerance up that now had diminished, so they're looking at a dosage that's too high. And then plus they're not using the same stuff they used when they came in here 6 months ago or a year ago or whatever. So that is a recipe for disaster in itself. And so tragically, it doesn't take but one bad decision to end what had been maybe a series of really good decisions they've been making for a long time.
Yeah. Well, I know the fight goes on, and I know it's days like this and yesterday which make it very hard.
Right.
And I see that throughout the program, and I'm not as close to a lot of the names that we've lost, those men. But the longer I'm here, the more I am, and I see that. And yet, I guess all we can hope is that the next man that comes through, we can also offer them the gospel and change their lives forever.
Right.
And whatever may happen.
Right.
Well, thanks for sitting down and talking about it, Tom. And thanks for all the work you do and following up with families and being a real pastor in their lives, because I know they need it desperately in times like this.
Thanks.
Well, we thank you for joining us today. And if you have any questions or like to know more about how you can get involved in programs like this, please check out our website at hiswayinc.org.